All right. So the recording should be started. But thank you guys again so much for coming. It's our last exam review, so that's super exciting. I know you guys are going to do great on your exams. So let's get started. All right, so we're going to jump right into questions like we normally do. So the first question is, a nurse is caring for a child who has had watery diarrhea for the past 3 days. Which of the following is an action for the nurse to take? A, offer chicken broth. B, initiate oral rehydration therapy. C, start hypertonic IV solution. Or D, keep NPO until diarrhea subsides. And then go ahead and put your answers in the chat. All right, perfect. Really great job, you guys. So yes, the answer is B. We do want to initiate that oral rehydration therapy. They're going to be really dehydrated. They need those lost electrolytes. So perfect. All right. A nurse is caring for a child who has hypertonic pyloric stenosis. Which of the following manifestations should the nurse expect? Select all that apply. Projectile vomiting, dry mucous membranes, current jelly stools, sausage-shaped abdominal mass, or constant hunger. All right. Great job, you guys. You guys did really good with this one. So A, B, and E is correct. Does anybody know what C and D are manifestations of? You can just go ahead and throw it in the chat. Yeah, really good job, guys. You guys got that one perfect. You guys are doing really well with your studying. I see there's a hand raised. If you want to unmute your microphone, you can say something. No? Okay. All good. All right, we'll go ahead and go to the next one then. All right. A nurse is caring for a child with Hirschsprung's disease. Which of the following actions should the nurse take? Encourage a high fiber, low protein, low calorie diet, prepare the family for surgery, place an NG tube for decompression, or initiate bed rest. Really great job, you guys. So the correct answer is B. You want to prepare the family for surgery. So surgery is required for this disease process. And then for A, it's the exact opposite. So remember, for these kiddos, we want low fiber, high protein, high calorie. Good job. All right. All right. A nurse is teaching a caregiver of an infant about gastrointestinal reflux disease. Which of the following should the nurse include in the teaching? Select all that apply. Offer free with rice cereal, use a bottle with a one-way valve, position the baby upright after feedings, and use a wide base nipple for feedings. All right. Great job, you guys. So A, B, and D is correct. For C and E, those would be your infants who have a cleft palate. So good job. All right. A nurse is teaching a parent of a child who has a urinary tract infection. Which of the following should the nurse include in the teaching? Select all that apply. Wear nylon underpants, avoid bubble baths, empty bladder completely with each void, watch for manifestations of infection, and wipe perineal area from back to front. All right, you guys got this one really quick. Good job. So it's B, C, and D. For A, we want them to wear cotton, and then for E, you want to wipe front to back. All right, a nurse is planning care for a child who has a urinary tract infection. Which of the following interventions should the nurse include? Administer an antidiuretic, restrict fluids, evaluate the child's self esteem, or encourage frequent voiding? All right, awesome job, you guys. So you guys got that one really fast. The answer is encourage frequent voiding. This is just going to flush out all the bacteria through the urinary system. So great job. A nurse is assessing an infant who has a suspected urinary tract infection. Which of the following are expected findings? Select all that apply. Increase in hunger, irritability, decrease in urination, vomiting, and fever. All right. So let's talk about this one a little bit. So the correct answer is actually B, D, and E. So for an infant, it would be expected to have them really irritable. They might have decreased urination, and then they could also have a fever. So the reason that C is not correct, or the reason that C is not correct is they would have an increase in urination. Um, so they would have vomiting, they would have a fever, they would have an increase in hunger. Sorry, I feel like I went all over the place for that one for you. Um, but hang on, I am that's for you guys. Correct answer is B, D, and E. You would have a decrease in hunger for infants, and you would have an increase in urination. They would be irritable, they could have vomiting, and they would have a fever. Sorry, I feel like I totally confused you guys. I was like reading off of this and not saying it correctly. So there would be an increase in urination with an infant who has a urinary tract infection because their body is trying to flush out all that bacteria. So, like in the other question, that was encouraging frequent voiding. So you would want them, if it's a toddler, a child, to go to the bathroom whenever they have to. An infant is going to be in diapers, so you may see that increase in urination because, again, it's just their body trying to flush out all of that bacteria. So, really great question. All right, a nurse is caring for a child who has enuresis. Which of the following is a complication? Urinary tract infections, emotional problems, urosepsis, or progressive kidney disease? Yeah, really great job, you guys. So the correct answer for this one is B, emotional problems. A, it can occur in kiddos, but it's not necessarily a complication of this disease process. And then urosepsis and progressive kidney disease are going to be complications of UTIs. All right. A nurse is caring for a school-aged child who has acute glomerulonephritis. Which of the following findings should the nurse report to the provider? A BUN of 8, a blood creatinine of 1.3, a blood pressure of 100 over 74, or a urine output of 55 or 550 mLs in 24 hours. All right. so let's go over this one. So the correct answer for this one, this is going to be a finding that we report to the provider. So it's going to be something that is out of range. That's going to be our blood creatinine of 1.3. Something like a memory trick that I always keep with me is from Simple Nursing. So if you guys watch Simple, or if you don't watch Simple Nursing, I highly recommend. It is super, super helpful. But he has a saying where he says creatinine over 1.3 is a bad kidney. And that is always something that sticks in my head. So if you have a kiddo with acute glomerulonephritis and you have a blood creatinine of 1.3, it's out of the range that we want it to be for a kiddo. So we would report that, make sure that the provider is aware. Yes, they have the acute glomerulonephritis, but all of the others are within the expected range for that kiddo. So hopefully that makes sense. A nurse is caring for a child who has acute post-streptococcal glomerulonephritis. Which of the following manifestations should the nurse expect? Select all that apply. Pale urine, preorbital edema, ill appearance, decreased creatinine, and hypertension. All right, really great job, you guys. So the correct answer is B, C, and E. For A, they would have like cloudy tea-colored urine. And then for D, they would have an increased creatinine, which we just talked about in the last one. So good job, you guys. All right, a nurse is reviewing cerebrospinal fluid analysis for a client who has suspected meningitis. Which of the following findings should the nurse identify as indicating viral meningitis? Select all that apply. Negative gram stain, normal glucose content, cloudy color, decreased white blood cell count, normal protein count. All right, so let's go over this one. The correct answer for this is A, B, and E. So for C, you wouldn't expect it to be cloudy. You would expect it to be clear. And then for E, for E, you expect the protein to be normal. For D, D is not correct because you would expect the white blood cell count to be normal. Um, this is viral meningitis, so just making sure that you know the difference in what the cerebral spinal fluid will show for a bacterial meningitis versus the viral. So if it was bacterial, it would have a positive gram stain, things like that. But really good job, you guys. All right, a nurse is caring for a child who has suspected meningitis and a decreased level of consciousness. Which of the following actions should the nurse take? Place the child on NPO status, prepare the child for a liver biopsy, position the child in dorsal recumbent position, or put the child in a protective environment. All right, let's go over this one because this one is a little tricky. But the key word here was decreased level of consciousness. So it actually, with the rationale, because this one tripped me up a little bit too, is you're going to want to place the child on NPO status. Because of that decreased level of consciousness, they're at a risk for aspirating. So obviously, safety first in everything that we do. Going to want to make them NPO so that we reduce that aspiration risk. For D, putting the child in a protective environment. If they have suspected meningitis, we want them on droplet precautions. So a protective environment would be more for an immunocompromised kiddo. But for these, we want them on droplet precautions for at least 24 hours after we initiated the antibiotics. So hopefully that one made sense. All right, a nurse is assessing a 4-month-old infant who has suspected meningitis. Which of the following manifestations should the nurse expect? Depressed anterior fontanelle, constipation, presence of the rooting reflex, high-pitched cry. All right, great job, you guys. So the correct answer for this one is D, the high-pitched cry. For an infant with meningitis, you would see a bulging anterior fontanelle instead of constipation. You would have vomiting, and then the presence of the rooting reflex is an expected finding that we would want to see in all infants. In the previous question, protective environment didn't necessarily mean seizure precautions. No. So if the answer choice had if seizure precautions was an answer choice in there, it would be super, super clear. The protective environment is just protecting them from infection, if that makes sense. All right. A nurse is reviewing the medical record of a child who has Rey syndrome. Which of the following findings should the nurse identify as a risk factor for Rey syndrome? Recent history of infectious cystitis caused by Candida, recent history of bacterial otitis media, recent episode of gastroenteritis, or recent episode of influenza meningitis. I'm not saying the first word because I do not know that. Um, All right, let's go over this one. So this one is actually going to be a recent episode of gastroenteritis. So Rey syndrome is typically going to follow a viral illness. All of the other ones are going to be bacterial, or the candida is fungal. So that is why C was the correct answer, because it's the only viral illness. All right. A nurse is caring for a child who just experienced a generalized seizure. Which of the following is the priority action for the nurse to take? Position the child in a side lying position, try to determine the seizure trigger, reorient the child to the environment, or note the time of the post-ictal period. All right, you guys got this one super fast, so good job. The correct answer is position the child in a side-lying position. So this is going to maintain the patent airway, prevent aspiration. All the other things are important things to do with the kiddo who has had a seizure, but they are not our priority. All right, a nurse is caring for a child who has absent seizures. For which of the following findings should the nurse expect? Loss of consciousness, appearance of daydreaming, dropping held objects, falling to the floor, having a piercing cry. All right. So the correct answer for this one is A, B, and C. So these are all things that we're going to see with an absent seizure. D and E are going to be things that you would see with a tonic-clonic seizure. So really good job, you guys. All right, a nurse is teaching a group of caregivers about the risk factors for seizures. Which of the following factors should the nurse include in the teaching? Select all that apply. Febrile episodes, hypoglycemia, sodium imbalances, low blood lead levels, sorry, presence of diphtheria. All right, good job, you guys. You guys did really great with this one. So the correct answer is A, B, and C. So febrile episodes can cause tonic-clonic seizures. Hypoglycemia is going to be a late sign of seizure manifestations. And then sodium imbalances. Anytime you think of sodium imbalances, think the brain is not happy, seizures are a possibility. You would actually have a high blood lead level for a risk factor for seizures. And then E just is not related to seizures at all. So good job. All right. A nurse is developing a plan for a toddler who has cerebral palsy. Which of the following actions should the nurse include? Structure interventions according to the toddler's chronological age, evaluate the toddler's need for an evaluation of hearing ability, monitor the toddler's pain level routinely using a numeric rating scale, and provide total care for daily hygiene activities. Um, Sorry, I'm reading one of your questions and I want to give you the right answer. So somebody asked, is hypothermia a risk factor too? Because that has been on a couple practice tests. Um, that one, I'm not 100% sure. I'll look into that. Um, because I know with like infants and stuff, we've talked about like therapeutic hypothermia. So I want to make sure that I'm giving you guys the correct answer and not confusing you. So look into it and I will get back to you on that. But yeah, you guys are absolutely correct on this one. The correct answer is going to be B. So a toddler who has cerebral palsy, you want to evaluate their need or you want to evaluate their hearing ability because they're at an increased risk for a hearing impairment. All right, a nurse is caring for an infant who has a myelomeningocele. The nurse should include which of the following actions in the preoperative plan of care? Assist the caregiver with cuddling the infant, assess the infant's temperature rectally, place the infant in a supine position, or apply a sterile on the sac. All right, you guys got this one really, really quickly. Awesome job. So the correct answer is apply a sterile moist dressing on the sac. Really good job with that one, you guys. Thanks. Note said temperature changes, but mainly saw febrile episodes. So yeah, that's really going to be the big one. Is if they have that really, really high fever, they're at a risk for the seizures. So if you remember that, you should be pretty good. All right. A nurse is reviewing sick day management with a parent of a child who has type 1 diabetes mellitus. Which of the following should the nurse include in the teaching? Select all that apply. Monitor blood glucose levels every 3 hours. Discontinue taking insulin until feeling better. Drink 8 ounces of fruit juice every hour. Test urine for ketones. Call the provider if blood glucose is greater than 240 milligrams. All right, you guys did awesome with this one. So the correct answer is A, D, and E. They want to continue taking their insulin to prevent hyperglycemic episodes, and then they want to drink fluids without sugar. So we definitely don't want them having 8 ounces of fruit juice every hour. Good job, guys. All right, a nurse is teaching a child who has type 1 diabetes mellitus about self care. Which of the following statements by the child indicates understanding of the teaching? I should skip breakfast when I'm not hungry. I should increase my insulin with exercise. I should drink a glass of milk when I'm feeling irritable. I should draw up the NPH insulin into the syringe before the regular insulin. Really great job, you guys. I should drink a glass of milk when I'm feeling irritable. So, irritable is going to be one of the first signs of hypoglycemia. So, they want to get their blood sugar up with that glass of milk. With the NPH insulin, what is the correct order for drawing that up? This is just a bonus question, but this shows up on like every single NCLEX practice ever. Regular, then NPH, clear before cloudy. Good job, you guys. All right. A nurse is caring for a child who has type 1 diabetes mellitus. Which of the following are manifestations of diabetic ketoacidosis? Select all that apply. Blood glucose of 58 milligrams, weight gain, dehydration, mental confusion, and fruity breath. You guys got this one super, super fast. Yep, the correct answer is C, D, and E. So for a kiddo who has diabetic ketoacidosis, we'd see weight loss, not weight gain, and we would have a blood glucose of at least 300. 58 would be dipping into hypoglycemia. So good job. All right, a nurse is teaching an adolescent who has diabetes mellitus about the manifestations of hypoglycemia. Which of the following findings should the nurse include in the teaching? Select all that apply. Increased urination, hunger, poor skin turgor, irritability, sweating and pallor, Kussmaul respirations. All right, good job, you guys. You guys got this one super fast as well. This is B, D, and E. Really good that you know all your diabetes stuff because I promise it shows up all the time. So A and C are going to be manifestations of hyperglycemia. So that's why those are incorrect. If I'm sure you guys have heard it already, but something that has helped me so many times with answering these kinds of questions is remembering the saying, cool and clammy needs some candy, and then hot and dry, sugar high. And so if they have symptoms of being cool, clammy, anything like that, you know, hypoglycemia. If they're really hot and dry, dehydrated, things like that, they're going to be in hyperglycemia. All right, a nurse is providing instructions to the teacher of a child with ADHD. Which of the following classroom strategies should the nurse include in the teaching? Select all that apply. Eliminate testing, allow for regular breaks, combine verbal instruction with visual cues, establish consistent classroom rules, and increase stimuli in the environment. Great job with this one, you guys. So the correct answer is B, C, and D. These are all going to be really important things to help a kiddo with ADHD. A, we don't want to eliminate testing, but working with the teacher or the school to get them extra time for testing is going to be really important. And then we want to decrease the stimuli in the environment for them so that they can focus better. So great job with that one. All right, a nurse is teaching the parent of a child about risk factors for ADHD. Which of the following should the nurse include in the teaching? Formula feeding as an infant, history of head trauma, history of post-term birth, and a child of a single parent. That should say parent. Yeah, great job, you guys. So the correct answer is history of head trauma. All the others are not risk factors for ADHD. All right, a nurse is caring for a child who has depression. Which of the following findings should the nurse expect? Select all that apply. Preferring being with peers, weight loss or gain, report of low self esteem, sleeping more than usual, hyperactivity. Awesome job with this one as well. So the correct answer is B, C, and D. They would be isolating themselves with depression. That would be a finding that we would expect. So not preferring to be with others. And then they would have a lot of fatigue, might be sleeping all the time instead of being hyperactive. So good job. All right. A nurse is providing teaching to a parent of a child who has a new prescription for a liquid oral supplement, a liquid oral iron supplement. That did not get put in there. That should be put in there. So it's iron, guys. Which of the following statements by the parent indicates an understanding of the teaching? I should take my child to the emergency department if his stools become dark. I should avoid eating citrus fruits while taking the supplement. I should give iron with milk to help prevent upset stomach. Or my child should take the supplement through the straw. You guys got that one super, super fast. Great job. So the correct answer is my child should take the supplement through a straw. So remember those dark, like green tarry stools are going to be completely normal, an expected finding when you are taking a therapeutic amount of iron. You want to encourage them eating citrus fruits because of the vitamin C in it will help absorb the iron. And then you don't want to give it with milk because the milk inhibits the absorption of the iron. So you want to make sure that you give milk an hour before or 2 hours after, never with. Good job, you guys. And we get it through a straw so that it doesn't stain their teeth. All right, a nurse is teaching the parent of a child who has a Wilms tumor. Which of the following statements should the nurse include in the teaching? Select all that apply. Your child would need to have chemotherapy for 12 months. Wilms tumor are typically genetic in nature. Surgery is done usually within 48 hours of diagnosis. Palpating the tumor could cause the spread of the tumor, and further treatments will start immediately after surgery. Just take your best guess, too, if you don't know. We'll go over it. All right, let's talk through this one. So the correct answer is C, D, and E. So surgery, it's best practice to do surgery to remove the tumor within 48 hours. Um, Palpating the tumor could cause it to rupture, so that's why that one is correct. If it ruptures, it could spread the tumor. And then further treatments will start immediately after surgery. So right after surgery, they'll be started immediately on chemo and radiation. The reason that A is not correct is chemo is going to be dependent on the individual and the stage of the tumor. So it could be less than 12 months, could be more. That's going to be a not a like one hard fast rule for this type of tumor. And then they are not typically genetic in nature. It's about only 2% of them are genetic. So that's why B is incorrect. Good job, you guys. A nurse is caring for a child who is post-operative following surgical removal of a Wilms tumor. Which of the following assessments is an indication to continue NPO status? Abdominal girth of 1 centimeter or larger than yesterday, report of pain in the operative site, absent bowel sounds, or passing of flatus every 30 minutes. Awesome job with this one, guys. So the correct answer is C, absent bowel sounds. Their bowel sounds are absent. We definitely want to keep them MPO, so great job. Abdominal girth of 1 centimeter or larger than yesterday. That could just be like some edema that they're having and report of pain in the operative site. That's an expected finding. They just had surgery, so they're definitely going to be in a little bit of pain. Good job, you guys. All right, a nurse is planning care for an infant who is scheduled for a lumbar puncture. Which of the following actions should the nurse include in the plan of care? Cleanse the thoracic area of the infant's back with an antiseptic solution, apply a local anesthetic cream just before the procedure begins, restrain the infant with his head extended and chin raised, position the infant during the procedure to prevent movement. Really great job, you guys. So we're going to want to position the infant during the procedure to prevent movement. Preventing movement is going to prevent the potential for injury. With the local anesthetic cream, you want to apply that 45 to 60 minutes. And for the positioning, you want the neck flexed and chin to chest. All right, a nurse is assessing a child who has leukemia. Which of the following are early manifestations of leukemia? Select all that apply. Hematuria, anorexia, petechiae, ulcerations in the mouth, unsteady gait. Yeah, you guys did really well with this one. You guys got it. So the correct answer is B, C, and E. Hematuria and ulcerations in the mouth are manifestations of leukemia, but they are late manifestations. So good job catching the early manifestations. All right, a nurse is caring for a child who has thrombocytopenia. Which of the following actions should the nurse take? Select all that apply. Monitor for manifestations of bleeding, administer routine immunizations, obtain rectal temperature, avoid peripheral venipunctures, and limit visitors. Great job, you guys. The correct answer for this one is A and D. So they have low platelets, so they are at an increased risk for bleeding, which is why we're not going to give them their routine immunizations, and we're not going to obtain a rectal temperature. It can lead to tissue injury and bleeding. And then limiting visitors, they don't need to have visitors limited. That would be for like a neutropenic patient. All right. A nurse is providing home care instructions to a parent of a child who is receiving chemotherapy. Which of the following instructions should the nurse include in the teaching? Select all that apply. Manifestations of infection, bleeding precautions, hand hygiene, homeschooling, airborne precautions. All right, really great job with this one, you guys. The correct answer is A, B, and C. So the chemo will destroy their healthy white blood cells. So now they're at an increased risk for infection, which is why we want to teach them about infection and then make sure that they have good hand hygiene. And it's also going to destroy their healthy platelets, which is why we want to put them on bleeding precautions. But a kiddo who's on chemo can still go to school, and they would need airborne precautions. If anything, they would be on neutropenic precautions. So great job. All right. A nurse is caring for an adolescent who has a new diagnosis of osteosarcoma. Which of the following actions should the nurse take first? Ensure that the adolescent has a referral for a psychiatrist visit, prepare a teaching plan to educate about the diagnosis and treatment, spend time with the adolescent to answer any questions, and perform a mental status exam to assess the adolescent's thought patterns. All right. Really great job with this one, you guys. So the correct answer is C. You want to spend time with them to answer any of their questions, be there for them, listen to them. They're probably going to have a lot of questions. They're probably going to be concerned. Um, they might be just like trying to process everything. So, the best first thing that you can do is just sit there with them, listen to them, answer their questions, listen to their concerns, and be there for them. All the other things are absolutely great things to do, but they're not indicated at the time of the initial diagnosis. At the initial diagnosis, we really just want to be there for the patient, and answer any kind of questions that they have. Good job, you guys. All right. So that is the end, of all of our practice questions. So you guys are almost done with level two, which is super exciting. You honestly should be so proud of how much you've learned and grown in this semester. I think I grew the most in my level two and my level four semesters. So you guys should be so, so proud of yourself. Thank you guys for coming. If you come to all of the review sessions, thank you for coming to all the review sessions. I hope they've been helpful. We didn't have them when I was going through level two, or we didn't have the women, children, family one when I was going through level two. So hopefully this helps. You guys do amazing on your exams. I'm going to upload the PowerPoint that'll have all of the answers and the rationales in the notes so that you guys can, use them. I know your exam is tomorrow, but it's been a crazy week for you guys and for us. So I'm glad we could still get it in. I'll be posting the PowerPoint, like I said. If you have any questions, let me know. Get some sleep tonight, rest. You guys did amazing. You guys are going to do amazing tomorrow. So I'm going to stop the recording and then I'll stay on to answer any questions.